Hello again from Dental XP. I'm Dr. Maurice Salama, and today we're going to be speaking about the most common, or one of the most common procedures in all of dentistry, the tooth extraction. Trying to make this as atraumatic as possible, we're going to be highlighting a particular type of forceps system called the golden mish. This is a fairly new concept in tooth extraction that applies a completely different system to what we've known in the past. On animation, simply following the technique is to use a microperiosteal elevator to separate the epithelium and connective tissue attachments to the subgingival root structure. We then want to attach the lingual portion of the beak beyond the CEJ apical onto sound root structure. As you can see from the animation, the bumper on the buccal aspect should be set in the vestibule, approximating the mucogingival junction. We're then going to go as far away from the beaks as possible with very slight and very slow rotational force in the direction of the bumper. You don't want to use this as a lever, and you don't want to put excessive force close to the beak tips. The idea here is to slowly separate the periodontal ligament, and this weakens the surrounding bone. That separation occurs in a slightly occlusal and buccal direction, and you will soon feel the tooth just slightly elevated occlusally out of the socket, as you see clearly on this animation. And this occurs with very gentle tooth movement and pressure. Once this is done, a conventional forceps can be used to extract the root. You can see here in a clinical case utilizing the physics forceps, the lingual is attached beyond the CJ on sound root structure, and the buccal pad is placed in the vestibule, approximating the mucogingival junction, as previously shown on the animation. My fingers are as far away from the beaks of the forceps as possible, applying very light and slow pressure in the direction of the buccal pad. This gives you the same type of effect as you would in lifting the top of a bottle from a beer bottle, as we'll show you soon. You can see how this tooth has emerged, slightly buccal and occlusally, and now we can rotate it out with conventional forceps. An otherwise conventional extraction done in an atraumatic manner. And again, completely different than what we were taught to do in the school, and very similar to how we would open, in this case, a beer bottle. In this case, the only difference would be we want to be as far away from the fulcrum as possible with slight finger pressure, and utilize only the beginnings of the lift of that top of that beer for the removal of the tooth. I'd like to thank you for your time in assessing this new technology, and I hope it helps you in your future endeavors with tooth extraction. Thank you very much. I'm Dr. Maurice Salama for Dental XP.